Now see, there are many complications which can lead you to the progression of atherosclerosis. I will cover only few of them which are most common and how we can manage it by few changes. Let's first discuss about the other causes and then we will discuss about how to deal with it. So in my last video we were in the middle of this lipid abnormalities. Now many people might be believing that these lipid abnormalities is due to dietary fats which they eat. But actually that is not the case. We will cover this in our next part of the video. So for now, first understand what is obesity. Obesity is a condition which usually and mostly happens due to our dietary habits, sedentary lifestyle, lack of exercise, etc. Now see, hypothyroidism is linked with your slow metabolism. I agree. But this hypothyroidism is not directly linked with obesity. The thing is that it is manageable, but somehow people blame this hypothyroidism as the number one reason for obesity. No, it's absolutely wrong. It's your dietary habits and lifestyle. To understand thyroid, we have to go deep into detail. Hence, we are not covering about thyroid. I will make a special series dedicated to thyroid and its function. Now with this obesity, there are so many complications linked. Few of them we had discussed in my last video. One of them is without any doubt is diabetes mellitus or insulin resistance, which is type 2 diabetes, in which your cell does not respond to insulin. I had discussed in my previous video about receptors. So there are insulin receptors also in our cells like this skeletal muscles and adipocytes. So due to chronic high blood sugar level, these insulin receptors are damaged and become resistant. That means they do not respond to, those receptors do not respond to insulin. Now in simple terms, understand that insulin is a key and your cell has a lock which is called receptor. These insulin fuses with receptors and the cell allows the sugar to enter from extracellular region to intracellular region where this sugar is metabolized. Now imagine if this mechanism does not work. What will happen? The sugar will stay in your blood, and this high blood sugar level along with the high insulin level is one of the major cause of atheromatous lesion. One more thing I want to mention, that I am nowhere saying that you shouldn't be eating sugar. Okay, craving for sugar is one of our survival mechanism, of course, but nowadays we have easy access to plenty of sugar and carbohydrates that we cannot compare this world with our primitive world. See, our ancestors used to roam around. They were never used to stay at one place until they started growing their own food through agriculture. This survival mechanism helped them to store sugar as a source of energy in the form of fats. These fat cells used to fuel them when they don't eat for several hours, sometimes a day or more. And when they find some fruit hanging on a tree, they eat it and they crave more to eat more so that they can sustain for a long time. This sugar craving as a survival mechanism is also due to its sweet taste, because this indicates that it is a safe thing to eat, and that's why we never enjoy eating bitter foods. It's in our genes though. So in today's world we have plenty of sugar around us, which leads to obesity, and that leads to high triglycerides and high cholesterol levels. This obesity also increases risk of hypertension. This also lowers the level of HDL, high density lipoprotein. As I discussed earlier, that it is responsible to take the cholesterol back to the liver. Also, I would like to mention that in severe cases, a patient may develop a very severe type of atheromas in lower limb vessels, which is called lower limb ischemia, which I had discussed in my previous video. This develops the risk of gangrene, which means dead tissue. Obviously, if blood vessels are blocked, there is no blood supply to the lower limb. Hence, these patients suffering from gangrene may lose their leg. Also, smoking and alcoholism plays a major role for the progression of this condition. Talking about smoking, it can also bring the HDL level down. There are several toxins which comes through smoking, which damages the endothelium directly. Hence, inflammation occurs, okay, at the lesion. Now if someone is smoking one packet of cigarette a day for several years, it can lead to long-term chronic injury to the endothelium, and the chances of atherosclerosis lesions increases up to 200%. Another rare condition is homocysteine level. Though we will not go into detail of it, simply remember that homocysteine levels, if high in the blood, it can damage the endothelium. Though it is a rare condition, yes, but one important thing, this homocysteine levels can be shoot up by the deficiency of vitamin B6, which is known as folate or folic acid. There are also different types of toxins that can damage the endothelium, like endotoxins. Again, we will not cover endotoxins and exotoxins in detail because this itself is a vast topic which I might cover someday. This is not that important for you, but for your curiosity, understand that this endotoxin can also lead to infection and damage of the endothelial lining. Some of the virus and bacteria are also related with atherosclerosis. A virus named cytomegalovirus, I hope my pronunciation is correct, cytomegalovirus, and bacteria named chlamydia pneumoniae. These bacteria excites our immune responses. Remember the soldiers of our body. So these bacteria excites white blood cells, which then further damages the endothelium. Also, now most important, the type of personality of any person. There is a personality called type A personality. These people are very competitive personality. They are very short-tempered, over-ambitious, want to control everything, very impatient, and there are also many qualities they have. There is nothing bad in being competitive and ambitious, but remember, anything excessive can lead you to complications. So these people are at high risk due to their stressful life. Another reason for this problem is your sedentary lifestyle, which of course is going to lead you to atherosclerosis. Now we all know about this sedentary lifestyle thing, which is again the number one reason for obesity. This age also plays a major factor. As we age, this atherosclerosis complications increases between the age of 40 to 60 years in men, and actually the risk increases 5 times. This disease is more common in men. In case of women, they are somehow protected with this disease because estrogen, the female sex hormone, okay, like we males have testosterone as a sex hormone, females have estrogen. So these estrogen reduces the development of atherosclerosis. Yeah, but the problem may occur after the menopause, and sometimes women may suffer from atherosclerosis before menopause by other factors like severe hypertension, severe hypercholesterolemia, which is high cholesterol, and severe diabetes, and also smoking habits. But women at the age of 60 to 70 years carries more risk of this problem. We had discussed earlier about the congenital disease like familial hypercholesterolemia. Due to this inherited condition also, complications may occur at an early age.